Hello, my name is Pauline Young and I am a parent carer of a young man with learning disabilities and autism called Matthew, who has had considerable experience of hospital care in the last few years. I also chair the trustees of the All Wales Forum of Parents and Carers of People with Learning Disabilities. I should like to introduce you to a short film about the Learning Disabilities Care Bundles Checklist. This is what it looks like. It's formatted like a folded credit card so that it's easy for you to carry it around. This checklist is available to all people with a learning disability and their parents and carers. We will be showing you various sections of this card in more detail throughout the film. The checklist is a set of guidelines that you can use to ensure that people with a learning disability receive quality healthcare, and also that their parents and carers understand what they have a right to expect when their relative is admitted to hospital. For you to understand why the All Wales Forum considers care bundles to be an essential element of hospital care, we would like to show you a short film about the experiences of a man called Paul Ridd.
My name is Jane Nichols. I am Paul Ridd's sister.
My name is Jonathan Ridd. I'm Paul Ridd's brother.
Paul was a very special individual. He was born in 1955 with a cord round his neck, which left him with severe learning disabilities. We were very privileged to have Paul as part of our family.
He was always smiling.
Very proud of Paul and blessed to have had him. Paul suffered with bowel conditions. He had a perforated bowel in 2000. It was New Year's Eve 2008. And he was taken into hospital and he spent 3 weeks in intensive care, where Paul was treated very well in intensive care because he was under sedation. But when Paul came round and we were put on a general ward, Paul's care deteriorated tremendously and Paul actually died from neglect in hospital. He didn't get the dignity, treated with the dignity or the respect that he deserved.
Given Paul's disability, we spent between us 24 hours at the hospital with him to make sure that he had a familiar face around him and he felt comfortable and supported. As Jane said, he undergone a major operation, was transferred prematurely onto a general ward where the error started. The medical staff and nursing staff definitely missed the signs, despite us as a family and carers constantly saying that Paul was deteriorating, that he was ill. They didn't react quick enough, and they kept putting Paul's condition down to agitation, and actually at the time he was dying.
We were telling them he wasn't well and nobody was reacting. They were giving him a diazepam for agitation. They were saying his clamminess was all due to his disability. The diazepam actually brought his death on quicker. So Paul actually died from diagnostic overshadowing. It means where they see the disability, not the illness. So it's a very, very tragic death.
His life wasn't valued like yours and ours.
We are tortured as a family by what Paul went through.
We wrote a letter to the coroner raising our concerns, which was a list of actually 33 questions. And we went through a number of meetings, attended a number of meetings with the hospital staff, of which they couldn't answer these questions. So then it instigated us taking it further, involving the Ombudsman, in order for us to really understand what happened to Paul and why he died.
The Ombudsman listened to us, took on our inquiry and proved that Paul had died from neglect and that the level of care that he received was dire and that his learning disabilities were not taken into account when he was treated in hospital. We have lost so much. We've paid the ultimate price losing Paul. We'll never get him back, but this is a legacy to Paul because there's changes that need to be made.
Training medical and nurses is very important, as understanding a person with a learning disability is, we see it as the key.
There needs to be communication between medical staff and family and carers, the people who actually know the individual, know all about them, because then they can tell them the different signs about how they show pain.
It's so important for nurses and medical staff to listen to carers, to listen to families, to really understand the person that they are trying to treat and care for in order to make the right decisions, which again is so pertinent for the well-being of that person.
My fears are that we see another story like Paul, that you put the news on and you read about somebody else who's died from neglect. That's our fears, our hopes that the work that's going on in the country makes a difference, so people actually get treated with the dignity that they deserve. They have a better healthcare experience, they live longer, and their lives are enhanced by a better system.
We will not stop until we see the changes that are required.
We weren't listened to, and as a result, Paul died.
Probably the most significant aspect of the film that you have just seen is the fact that Paul's final symptoms were not properly diagnosed. Nursing staff believed that his agitation was due to behaviour problems, rather than a cry for help because he was becoming more sick. This is called diagnostic overshadowing, and it's the tendency to attribute symptoms and behaviours associated with the illness to the learning disability, and for the illness to be overlooked. When a person presents with a new behaviour or existing ones escalate, you should consider, for example, physical problems, pain or discomfort, psychiatric causes, for example, depression or anxiety, social causes, for example, a change in carers or maybe a bereavement. This checklist provides you with 3 sections. Firstly, within 4 hours of admission, did staff notify acute liaison nurses and/or learning disability services? Did staff notify the patient's next of kin and/or the primary carer on admission? Did staff request a hospital passport for the person? These guidelines aim to ensure good communication between hospital staff and departments, as well as family members and supporters. As a carer, you will know lots of useful information about the person you support that will help hospital staff deliver the very best healthcare possible. Next, to be completed daily, the hospital should be creating, reviewing or updating the patient-centred care plan, which should be developed with the patient, family carer and/or paid support staff. The person-centred care plan should be communicated and shared with ward team members. A named nurse should be identified to the patient and family and other staff throughout the duration of the stay. These guidelines aim to ensure that all hospital care for people with a learning disability is person-centred and delivered according to their needs and preferences. And finally, within 7 days of admission, there should be a full multi-agency family and carers discussion with the aim of reviewing progress and/or planning discharge. This intervention aims to ensure that the person's condition, care and treatment are reviewed regularly so that progress can be monitored and discharge can be carefully planned in a way that it runs smoothly, is safe and appropriate. You will see that on your card You have the space to reflect on your experience through answering 3 questions. Was there good communication between you and hospital staff at all times? Were the guidelines completed and delivered according to the needs and preferences of the person? Was the treatment reviewed regularly? And did the discharge meet the needs of the person? The RID Foundation would really value your feedback on your hospital experience. It would be good if you could tell them the name of the hospital and the ward, whether it was a planned visit or an emergency, and if you are happy to do this, the name of the patient. They will, of course, keep all personal details confidential. You can email this information to the address on the cards, or write it in a letter and post it to the address provided. You may also send the card itself to the RID Foundation and request a replacement card from the All Wales Forum. Our aim in distributing the care bundles is to improve the quality of care for people with learning disabilities and their parents and carers by giving information around what you should expect from hospital care, through having your real stories, good examples and bad, and finally feeding that information back through to the Welsh Government so that families can be confident that they will receive quality hospital care across Wales from the minute they arrive at hospital to the time of their discharge and beyond. Finally, thank you for listening, and now a word from me as a mum. Our NHS in Wales works really hard to provide the very best for our sons and daughters. But we know that sometimes mistakes are made, as in the Paul Ridd story. We want to try and ensure that fewer mistakes are made in the future. So please, please get the cards, use the cards, and try to ensure that the NHS has all the information they need and that you get the best quality of care for your sons and daughters that you can possibly manage. Thank you so much for listening.